90% is a game changer. 90%, now you are hoping to have a tool in your war against this pandemic that could be significantly effective. How long this protection will last is something that we don't know right now, but it's part of the objectives of this study. We will follow up the 44,000 people that they received, they are part of this study for 2 years. And during this follow-up, obviously, we will be looking also the durability of the immune responses.
So a couple of points in there just to explain a little bit. First of all, 90% protection. Again, no matter how you cut it, that is terrific news. I think one of the big questions is 90% effective at preventing people from getting infected. Is it also 90% effective at preventing people from getting serious disease? Meaning, does it prevent milder or more moderate infections? Or does it prevent the serious infections that lead to serious COVID disease? He doesn't know. He didn't really know the answer to that, and we'll get a better idea when the data is unblinded. Also, this question we've talked about so many times on your program. How long does it last? Right? We know if somebody gets infected, they may have immunity for several months. It's a little bit of a question mark. How about with the vaccine? Is this going to be like a yearly thing of 2 shots? Again, he doesn't know. He says they're going to follow these patients for a couple of years.
Again, 90% effective, though, changes the equation. It's not like a flu vaccine, which is 30 to 50%. This is closer to measles, where you really start to push the virus away completely, potentially. We'll wait and see. Sanjay, I want to throw to another bite here of your interview with him, and this was fascinating, and this has to do with the when of it all. When will a supply ramp up to the point where more Americans can get it? Listen.
We believe that we are in good situation to have up to 50 million doses this year globally. And I believe we are in a very, very good situation to have 1.3 billion doses globally.
Sanjay, what do those numbers mean?
Yeah, so these are, again, much higher numbers than I had been here. We've been tracking this for some time. We thought that in the United States, perhaps hundreds of thousands of doses had been manufactured sort of at risk at this point. Mr. Bورلا said it's more in the millions. And then in the United States alone, he said there'll be tens of millions of doses available. In the United States, there's at least 3 of these manufacturing sites and distribution sites, and they're quite extraordinary. Kalamazoo, Michigan, for example, a football field worth of refrigerators now, where they're starting to basically store this vaccine, and they're going to start to distribute it. But also they have another facility, I believe he said it was in Germany or in Belgium, I can't remember, where they're going to actually be distributing in earnest over there for essentially the rest of the world. I mean, ultimately he thinks 1.3 billion doses in 2021, which would mean 650 million people. Again, this is a two-shot vaccine. So there's been a lot going on, I guess is what that means in terms of manufacturing this vaccine, even before there's any kind of emergency use authorization, let alone an approval. So that's good news in the sense that it'll be more quickly available. I think still for people in this country who think about this, we're still talking about springtime before this vaccine would be available. We're also hearing it would be free. I asked him specifically, somebody who's watching, I said, they want this vaccine. How much is it going to cost them? He says this vaccine, they're planning on making it available for free because the government has been buying this and planning on accessing as much of the vaccine as possible over the next several months.